Imagine waking up one morning, and your life is never the same again. Every year, hundreds of thousands of people have a stroke, and most of them had warning signs weeks before. They just didn't recognize them. Today, I'll show you the 7 early symptoms your body sends up to a month before a stroke, so you'll never be caught off guard. Let me ask you something. Have you ever wondered if your body tries to warn you before something serious happens? I mean, before a heart attack, some people feel chest pressure or get short of breath. But what about a stroke? Can the body send little signals weeks in advance? The short answer is, yes, sometimes it can. And those signals are sneaky. They can start showing up as early as a month before a stroke. Now, why should you care? Well, stroke isn't just a disease for old people. We used to think it only happened after 50. Not anymore. More and more younger adults, even people in their 30s, 20s, sometimes even teenagers, are being diagnosed. In the United States alone, almost 800,000 people suffer a stroke every year, and sadly, nearly 160,000 don't survive. Those are big numbers, and they're climbing. But here's the good news. If you catch the early warning signs, you can get help before the damage is done. That's why I want you to stay with me until the very end of this talk. I'll not only walk you through the 7 warning symptoms you must never ignore, but I'll also give you a practical game plan, steps you can start today to lower your risk and protect your brain. Let's start with the one that silently damages millions of brains every year: high blood pressure. It's called the silent killer for a reason. You can feel perfectly fine while your arteries are under constant strain. Think of your arteries as flexible garden hoses. Every heartbeat sends a wave of pressure through them. That's normal, but when the pressure stays high all the time, it's like cranking the water pump way up and never turning it down. Over time, those hoses start to crack, weaken, or even burst. Inside the brain, that can mean disaster. A ruptured vessel causes a hemorrhagic stroke, bleeding directly into brain tissue. But it doesn't stop there. Constant high pressure can also roughen the inner lining of arteries, making it easier for fatty plaques or blood clots to form. If one of those clots travels and gets stuck in a brain artery, you get an ischemic stroke, the most common type. The takeaway? Check your blood pressure regularly. If it's consistently high, don't just shrug it off. Work with your doctor, eat more fresh food, move your body daily, and take your medication if prescribed. Because once a stroke hits, there's no rewind button. We all get tired. Maybe you didn't sleep well. Maybe your boss piled on the work. But there's a difference between ordinary tiredness and the kind of deep, bone-heavy fatigue that makes you feel like you're walking through wet cement. If that exhaustion appears suddenly, hangs around for days, and you can't explain it, that's worth attention. Sometimes this kind of fatigue means your brain isn't getting enough oxygen-rich blood. It could be due to a narrowed artery or even a tiny clot that blocks flow for a short time. Doctors call this a transient ischemic attack, or TIA. I like to think of it as your brain's fire alarm. The flames aren't roaring yet, but the smoke detector is screaming. During a TIA, symptoms can mimic a full-blown stroke: weakness, trouble speaking, vision changes, but they fade within minutes or hours. Here's the dangerous part. Because they disappear, people tend to ignore them. Big mistake. A TIA is often the body's final warning before a major stroke. If you ever experience sudden, unexplained fatigue paired with other neurological symptoms, get checked immediately. Your eyes are like tiny satellites feeding your brain a constant stream of data. When blood flow to the brain changes, those images can get scrambled. That's why blurry vision, double vision, or sudden difficulty focusing can be early stroke warnings. Sometimes an artery feeding the eye itself becomes blocked. Imagine a camera lens slowly going out of focus. It's not just annoying, it's a sign that blood supply to your brain or eyes is compromised. And if that artery is blocked, it's often part of a bigger circulation problem. Yes, vision problems can come from many causes: fatigue, eye strain, even too much screen time. But here's the difference. Stroke-related vision issues tend to happen suddenly, without warning, and often alongside other symptoms. Don't wait to see if it passes. By the time a stroke fully develops, it's too late to prevent the damage that's already begun. We've all had bad headaches, but there's a special kind that doctors pay extra attention to, the one patients describe as the worst headache of my life. It comes on suddenly, like someone flipped a switch, and the pain can be blinding. This kind of headache is a red flag for bleeding inside the brain. In a hemorrhagic stroke, a burst vessel causes pressure to skyrocket inside the skull. The pain is intense, relentless, and often accompanied by nausea, vomiting, confusion, or even collapse. Sometimes such a headache can mean an aneurysm. A weak, bulging spot in an artery is leaking or about to rupture. Think of an overinflated balloon ready to pop. If you or someone near you has a headache so bad they can't even describe it, don't wait for it to settle down. Call emergency services immediately. Here's a classic stroke sign that can appear in the weeks or days before a big event. Sudden numbness or weakness in the face, arm, or leg, usually on just one side of the body. Sometimes it's subtle. Maybe your coffee cup feels heavier, or you notice a slight droop in your smile. Other times it's more dramatic. This happens because a part of your brain is temporarily starved of blood and oxygen. Even if the feeling returns quickly, don't assume you're fine now. That could have been a TIA, and remember, a TIA is not harmless. It's a warning that the real storm could be coming soon. If you suddenly can't form words, slur your speech, or can't understand what someone else is saying, your brain's language center might be in trouble. Doctors call this aphasia, and it's a serious red flag. The thing is, speech problems can be subtle. Maybe you just mix up words or feel like your tongue is heavy. But even minor trouble finding words can signal a temporary loss of blood flow to part of your brain. If it happens out of the blue, don't wait for it to happen again. That next time could be a full-blown stroke. Finally, there's the miscellaneous category, symptoms that seem unrelated but are actually neurological clues. This can include sudden balance problems, unexplained dizziness, confusion, memory lapses, or even nausea and vomiting without any stomach bug. The tricky part is that other conditions, migraines, low blood sugar, infections, can mimic these signs. But when they come on suddenly, especially in combination with any of the earlier symptoms, you should treat them as an urgent warning. An ischemic stroke is the most common, about 85% of all cases. It happens when something blocks blood flow to part of your brain, a clot from another part of the body, often the heart, or plaque buildup in brain arteries. Conditions like atrial fibrillation and irregular heartbeat can dramatically increase your risk because they make it easier for clots to form. A hemorrhagic stroke is different. Here, a vessel bursts and blood leaks into or around the brain, damaging tissues and raising dangerous pressure. The most common cause is uncontrolled high blood pressure, but aneurysms can also be to blame. Both types are emergencies. And here's a sobering fact. In many cases, there were warning signs in the weeks before the big event. People just didn't recognize them. A brain aneurysm is like a weak spot in a tire. Most never cause problems, but if that weak spot bursts, the damage is catastrophic. Some aneurysms give subtle warnings, sudden headaches, vision changes, or neck pain, but many don't make a sound until they rupture. If you have a family history of aneurysms, it's worth talking to your doctor about screening. Imaging tests like MR angiography can spot them before trouble starts. Treating an aneurysm before it bursts can literally save a life. You've heard the warnings. Now let's talk action. Lowering your stroke risk isn't complicated, but it does require consistency. First, know your numbers: blood pressure, blood sugar, and cholesterol. If they're high, work with your healthcare provider to get them under control. Eat more fresh vegetables, fruits, lean proteins, and whole grains. Cut back on processed foods, excess sugar, and unhealthy fats. Move your body. It doesn't have to be a gym workout. Even brisk walking for 30 minutes a day helps keep your arteries flexible. If you smoke, make quitting your top priority. If you drink, do it in moderation. Keep a regular sleep schedule. Your brain needs those nightly repairs. And perhaps most importantly, listen to your body. If something feels off, don't wait it out. Strokes don't happen out of nowhere. In many cases, your body starts whispering weeks before the big event. The problem is, most people aren't listening, but now you are. So pay attention to persistent high blood pressure, unexplained fatigue, sudden vision changes, severe headaches, numbness or weakness, speech troubles, and other odd neurological symptoms. Even if they pass quickly, they can be warnings you can't afford to ignore. Take care of your health today, so your brain can take care of you tomorrow. And remember, you only get one brain. Protect it like your life depends on it, because it does.